Back to the Ebola outbreak, and Uganda has closed its border with neighboring Democratic Republic of Congo with immediate effect to try to limit the spread of the disease. Uganda's senior health official Diana Atune says the border will be closed for 4 weeks except for Ebola response teams, humanitarian and security operations, and food and cargo transport. Uganda has reported 7 Ebola cases and 1 death in the outbreak, whose epicenter is in Congo's Ituri province.
It is 13 days since Uganda declared an Ebola outbreak in the country after the Ministry of Health confirmed 2 imported cases from the Democratic Republic of Congo. Since then, the cumulative number of confirmed cases has risen to 7, with 1 death recorded. Following the increasing number of Ebola cases in the DRC, government has announced a series of measures aimed at preventing further spread of the virus into Uganda. Last week, government suspended flights to and from the DRC, suspended cross-border bus transport, and stopped all public transport between Uganda and the DRC, among others, except for cargo transportation. However, despite these measures, many people were still crossing into Uganda on foot, including children who study in Uganda but reside in the neighboring Congo. Following a national task force meeting, government has announced the immediate closure of the Uganda-DRC border for 4 weeks. This means that even day scholars who study in Uganda but live in the DRC will not be allowed to cross during this period.
Uganda is temporarily closing the border with the Democratic Republic of Congo with immediate effect.
However, essential workers, including Ebola response teams, humanitarian workers, food and cargo transporters, and security personnel will be permitted to cross. This category of people will be subjected to strict health screening, fill in locator forms, and other health protocols.
If you have been there in DRC and you come to Uganda, you'll be required to undergo mandatory self-isolation for 21 days. But we shall do strict supervision of that isolation, and this applies in Kampala and also in all districts, especially the border districts where a lot of movements have been taking place.
Government has faced challenges in enforcing some of the Ebola prevention measures in border districts. Despite the suspension of weekly markets in high-risk border districts, for example, some markets, including those in Kasese district, operated this week. The Ministry of Health has now directed all resident district commissioners to strictly enforce all Ebola prevention and control guidelines. Places of worship will operate while observing the standard operating procedures, as well as schools in border districts.
School authorities are directed to identify all students that have come from DRC and have come in the school, especially for boarding schools. And these students must be monitored in terms of temperature taking daily for 21 days. 21 days specifically is very important in this case because Ebola incubation period is 21 days.
Government has suspended non-structured public gatherings and activities likely to attract large crowds and controlled movements and close physical contact. These include concerts, marathons, and similar events.
Concerts are not really structured. Marathon, people sweat, they go and then they all mingle. So for now, especially for the districts that are the border, because recently I think they were planning to have Virunga marathon. We are suspending it because it's right at the border, and that's where really the risk is. The music concerts, all these runs and all these things, all those we have suspended there.
Uganda has not recorded any new confirmed Ebola case since Monday. However, the number of contacts linked to the confirmed cases has increased. Most of them are health workers. Nobat Atkunda, NTV News.